Hello and welcome to In Service of Health, brought to you by the Public Health Accreditation Board. This is the podcast that brings healthcare and public health leaders together to inspire new thinking for healthier populations. In this episode, I sit down with Dr. Peter McCauley, a practicing pediatrician and strategic healthcare leader with experience working across the provider and payer space. Dr. McCauley is recognized as an expert in driving innovation in care delivery and payment reform, with an eye toward reducing disparities and aligning financial incentives with better health outcomes. We discuss the opportunities and challenges facing value-based care, the unintended consequences of people losing their health insurance, and the important role of pediatricians in building and maintaining trust with families. I hope you enjoy the episode. Dr. McCauley, thank you so much for joining us on In Service of Health.
Well, thank you for having me. It's a pleasure to be here, and I'm excited and looking forward to our conversation. Thank you.
Absolutely. So let's jump right in. Why don't you start by just telling us a little bit about what motivates you to do this work? You've had such an incredible career. What really motivates you?
Well, let me say, first of all, I have not lost the passion for healthcare. After close to 40 years, I always wanted to be a physician, and in particular, I wanted to be a pediatrician. I receive a significant amount of joy from helping others, and pursuing a career in medicine has allowed me to do that. And I've had the pleasure of being in a position to see patients individually as a pediatrician helping families, and as a healthcare executive to impact large populations of patients. So it's been a very rewarding career, but I think the primary motivation is just the joy of helping others.
I love that, and I'm sure that resonates with so many of our listeners. Let's talk about public health in particular. You talked about kind of the individual patient interactions, but talk about public health more broadly and why public health is important to you and should be important to society as well.
That's a good thing, and that's a good place to start. If you look at the current situation we're in, health and healthcare is facing so many challenges. If you look at the commercial healthcare space, for example, employers that provide healthcare coverage to their employees are looking at cost increases between 7 and 10% for 2026. We know that in this country, probably about a third of folks receive some type of subsidized health care. And clearly that is about to be reduced due to H.R. 1 that was passed this summer. And then we're seeing difficulty with regard to access. We know that the pipeline of medical students who are interested in pursuing primary care is decreasing. Some of that is due to medical debt that they take on in terms of their education and the need to pay that debt off, driving some students not to choose primary care, but to go into specialties. That creates a situation where access to care is important. And you make a good point that healthcare indeed is important to the individual physician, but is critical to society at large. And we have to do everything that we can to try to preserve access for all of us in our communities that require, deserve, and need healthcare services. Clearly a very important time in our history, and we need to do all that we can to support our healthcare system, particularly our public health system.
Thank you for noting that. And when we think about public health, we think about kind of the broad population and the things we do collectively, right, to improve health outcomes, but also to prevent disease. And so, to your point, those challenges, which look like they may be getting worse when it comes to cost and access, are so critical. So let's talk about our healthcare system, our imperfect healthcare system in the U.S. And we know you're a leader in the value-based care space. So we have a broad audience who listens to our podcast. Let's make sure we all level set. Like, what is value-based care exactly? And how is it different than how healthcare has historically been paid for in the United States?
To answer that, I think it's probably a good idea to start to have a clear understanding of how healthcare is currently paid for, by and large. Most healthcare services currently are reimbursed through the fee-for-service system. So a health system or a doctor provides a service to a patient. Maybe it's an outpatient visit, maybe it's a procedure, maybe there's a hospitalization. The provider of that service generates a bill. And then that bill is paid by someone or an entity. It could be paid by the patient. It could be paid by the health insurance company. But that service, the fee that results from that service, is paid to the provider. Very straightforward. In that system, the provider provides a service. The provider is reimbursed. The more a provider sees a patient, they're reimbursed every single time. So there's no relationship between frequency of visits or outcome. In other words, the service is reimbursed whether or not the patient's condition improves or whether or not the patient's problem is resolved. Value-based care, on the other hand, presents the opportunity for providers to be compensated in large part on health outcomes. In other words, is the patient's care better over a period of time than they were when they started engaging with the physician? And if you think about it, value-based care works particularly well when we're looking at large populations of patients. You have the ability to look at, across a population, healthcare metrics. For example, are the females in the population of concern receiving mammography screening appropriately? Are individuals with diabetes, for example, receiving medications to help manage their condition and other services that help improve their condition such that their long-term blood sugar control, like hemoglobin A1C, is improved over time? The idea being that you understand and look at the medical condition of the population at time A, you measure those medical conditions over time, and at the end of usually a 1-year measurement period, there's a reassessment of that population to determine if their health status improved, if their conditions improved. And if that's the case, then there's the opportunity for additional compensation for the provider or the hospital system that's involved in value-based care. And what that arrangement does is it really helps to drive a different level of engagement and interaction between the patient and the provider. It's in everyone's best interest to make sure that the patient is receiving preventive care services on time, that they have access to care, that they're taking a part in their healthcare management, and that they're engaged with the healthcare system on a continual basis in order to improve those outcomes. And in a way, it really kind of changes the conversation from intervention after the fact to prevention before deterioration. Mm-hmm. It's a different approach to reimbursement, and one that can really make a difference in terms of, again, how physicians interact with their patient population and the outcomes over time.
And thank you for breaking it down for our listeners. I think what's also inherent in what you said is that it could also potentially decrease costs. So talk to us a little bit about how this approach to quality care, not just, fee for service, can actually decrease costs. And I'm also thinking about, I'm an ER doc. People come into the ER, they may want a slew of 20 different tests because they've got whatever thing that's hurting them. And I know that may not necessarily be the best thing for them. So more is not necessarily better. So talk to us about driving down costs, whether it's the amount of care, the tests that are done, or even to your point about prevention.
Yeah, let's start with a couple of simple examples. We know that if you identify a condition early on and have the opportunity to intervene, outcomes are better because the medical condition is addressed. But addressing it in a timely manner reduces costs over time. So early identification, early intervention, and better outcomes. In a value-based care situation, the reality is that providers and their performance are compared to each other. And physicians are competitive. Health systems are competitive. Metrics like how conditions are cared for, how diagnoses are arrived at, what you referenced. Do I need to get a CT scan for someone that fell and maybe bumped their head? Do I need to do a colonoscopy for someone who's had recurrent heartburn? Probably don't need to do those things, but probably need to take a thoughtful approach to diagnosis that avoids unnecessary costs and exposing the patient and the healthcare system to unnecessary interactions, if you will. So think about it in terms of multiple levers that allow costs to be decreased. Identifying conditions and addressing them early, and then taking a thoughtful approach to assessment and use of diagnostic tools to decrease healthcare spend.
Absolutely. And as you're speaking, you're talking about healthcare delivery, but again, from a public health perspective, you're really talking about primary, secondary, tertiary prevention. So primary, preventing the disease in the first place, secondary, making sure there's good screening and prevention of progression of disease, and then tertiary, even if someone has diabetes and all that, making sure at least they stay as healthy as they can while they do have whatever that medical condition is. So again, that connection between healthcare and public health is so critical. Can you talk a little bit about, as you talk about prevention and quality and outcomes, how much can a clinician, physician, hospital system do to prevent that? And I'm thinking about those social drivers of health and how important they are as well to improving outcomes or preventing disease. Tell us more about that.
We all have the ability to communicate with one another, and the healthcare system has a particular talent and skill in terms of educating our populations about health-related issues. We need to continue to engage in meaningful ways with our population and our communities in terms of things that they might be particularly at risk for, the things that they need to be aware of that might identify them with regard to that risk category, and then things that they can do to improve their health and avoid deterioration of healthcare conditions. I think a lot of opportunity still exists in simple patient education and in dialogue and in community education overall.
Absolutely. And health literacy, it sounds like what you're talking about, and organizational health literacy as well, meeting patients where they are. Let's talk about, go back to value-based care for a moment. That sounds great. Of course, everyone wants high quality care, wants folks to get the right test at the right time. But why is it still so hard to scale value-based care? Like, what's the landscape there, and why is the entire healthcare system not operating like this yet?
There are a couple of reasons that actually bring to fore the reality that value-based care is not necessarily easy. It requires commitment, and it requires a few good, solid elements, like, for example, a robust electronic medical record system that allows you to have a clear understanding of the disease and conditions that exist within a population, and it allows you to identify those with certain risks that require intervention at certain times. The electronic medical record system also helps you to think about putting together, for example, action plans for individual patients that may, say, for example, have diabetes. That leads to discussions around condition and case management. So you have to have the ability to engage with patients outside of the hospital in a meaningful way to provide what we talked about earlier in terms of literacy and education, in terms of how to manage their condition. And to some extent, the value-based care reimbursement model does present some degree of risk to the physician side and the hospital side. And there are some providers and hospital systems that are just not equipped or not necessarily comfortable with taking on risk. And then the other clear issue is that fee-for-service is really ingrained in our reimbursement system, and value-based care takes real thought, planning, and commitment. And the physicians and the hospital system really have to sign on to the philosophy that they want to be measured, rewarded, and recognized for their outcomes, not just for what they're doing to patients or how often they're doing something to a patient.
You're right. Absolutely. A lot of risk there, and risk specifically of not making as much money. I mean, I'll just say it. There's money. Healthcare is a business for the most part in the United States, and there's a risk of not making as much money if you are held accountable for outcomes.
Yeah, and I'll kind of go back to what I mentioned earlier in terms of the fact that physicians are competitive. You probably have heard of what's referred to as the Hawthorne effect. When you publish data on physicians in terms of how their performance is, kind of it lifts all boats. No one wants to be in the bottom third of the performance tier. So value-based care from that lens, although risk is involved, does help physicians to think about their performance and where they can do better in ways where fee-for-service, it doesn't really matter. You see the patient, you're going to get paid.
Absolutely. Absolutely. I know when I get my quality scores, even if it has nothing to do with my paycheck, doctors inherently want to provide good quality care to their patients. And so I think that's an important point. You spoke about electronic medical records. Let's talk a little bit about data and data sharing, particularly between public health and healthcare delivery. The classic example is during COVID. I had the opportunity to lead Michigan's COVID public health response, and fax machines were a real thing, and still in some spots still are. And so the importance of in as real time as possible, data sharing between health systems, physicians, patients, understanding disease, how disease is, the incidence, prevalence, how it's spreading, risk. Tell us more about how data sharing plays a role from a public health and healthcare delivery standpoint.
Well, you outlined the criticality of access to data and information, and I think there's probably an opportunity for us to do better in terms of data and information exchange between private health insurers and public health access points. We know that, for example, on the employer side, an individual with employer-sponsored health insurance may be with that company 2 years, 3 years, 4 years. They may have situations where if they're unemployed, they move to a public health type situation. Ideally, it would be great because private insurers have troves of data and information on the populations that they provide services for. It would be ideal if that data and information moved with the patient, regardless of their health insurance status situation. So if they started with an employer, there's a data profile on that individual. If they move to the public system, if that information could move with them, that would make continuity of care improved, and it would probably lead to improved healthcare outcomes as well. And I don't know that that's a missed opportunity. I think states are doing a fairly good job of working on interoperability, but we need to continue to push that forward and think about how we can exchange information on both sides of the health provider equation in order to be efficient and allow patients to have a better experience when they move from one provider system to another, particularly with a change of employer. If you move from one employer to another, you may be required to move to a different health system or healthcare provider, and that requires you to either request your medical records to be transferred or actually go and obtain them yourselves and bring them to the new provider. It would be ideal if that information flowed seamlessly in an electronic version.
Absolutely. And then, you talk about even the quality of care. again, as an ER doc, I don't know how many times someone has come from wherever part of the country, they show up in my ER, they claim they had a CAT scan. I believe them. I have no
Mhm.
way to access it. It's gotten better, but there's still often times where you don't know, you've got a patient in front of you. What do? You hit the
Yeah,
button.
and then you have to make that decision. Okay, do I not order another CAT scan?
Exactly, exactly. So from a quality perspective, right, it's really, really important. So you talked about switching between insurers, not to get too wonky here, but churning, which often happens, particularly even between Medicaid and uninsured, and how people kind of are frequently, there's high rates of going back and forth. Um, let's talk about policy and Medicaid work requirements that are now the law of the land, and we know that millions risk, unfortunately, losing their insurance, including, quite frankly, people who are rightfully eligible for Medicaid. So, what should states, health plans, others be doing right now to mitigate the impacts of people losing their insurance, particularly those who are eligible for insurance due to these Medicaid work requirements, that loss?
There's a couple of things that come to mind. And the first one is accepting the reality that 5 million people in the United States will lose their health insurance coverage. The second piece, after accepting that reality, is for us to continue the dialogue about the importance of healthcare coverage for folks in this country, and then to think about the unintended consequences as a result of the new work requirements. Individuals will be required to certify certain actions, including seeking work or working or being volunteer service in the community on a much more frequent basis. And if a family is insured through the public system or through Medicaid and they lose their coverage, that means that those children are also at risk of losing their coverage. And currently in the United States, about 30%, between 30 and 40% of kids are either on Medicaid or the CHIP system following their parents. And if their parents lose those benefits, the children will likely be at risk for losing benefits as well. That's an unintended consequence. And the other unintended consequence is we know that as an individual's employment status improves, their healthcare status improves. Working is good for the soul, is good for the mind, and it gives the opportunity for individuals to engage in a meaningful way with the healthcare system. If individuals are locked out of healthcare, their overall health will deteriorate, and that's going to be deleterious with regard to employment and employment possibilities as well. And then we need to educate. Many health systems are starting now to educate their populations on the documentation requirements, the frequency, and what will be necessary to meet the obligations in 2027. That last piece, in terms of educating the population that's currently served by Medicaid, is critically important, and that's an area where we need to redouble our efforts as much as possible.
Thank you.
I wish I could say something more optimistic or something more cheerful, but the fact is that we will have to work doubly hard to make sure that everyone understands the new system and that they don't get discouraged and simply just give up.
Absolutely. Thank you for that. And those unintended consequences are so important. I mean, there are a lot of people who are employed and have Medicaid and will lose their insurance. So even as an employer, if you're
Yeah.
an employer, the health of your workforce is at risk here. When you don't have insurance, what are you more likely to do? Not see a primary care doc, delay care, end up in an ER, whatever conditions you might have. We talked about prevention earlier, diabetes, progression of that. So there's a real a spiral effect, if you will, of people losing their insurance. So,
And, one thing you brought up that I didn't mention is individuals ending up visiting the emergency room.
mm-hmm.
The emergency room is probably one of the most expensive places where you can access care. And if individuals are being shifted from their primary care situation to the emergency room, unintended consequence is going to drive up healthcare costs for all of us overall.
Exactly. Drive up healthcare costs, drive up even waiting room times because we've got
Yeah.
more folks in the ER. Again, speaking from experience, so you're right. We'll try not to be doom and gloom here, but it is not looking good for us. Uh, I also love you're practicing pediatrician, and I don't hear folks talk about children and children's health very much in the United States. Maybe it's just the spaces I'm in, but people don't often speak about the health of children. What are the opportunities in the United States to improve health outcomes for kids and children who may be underserved currently?
There are a couple of things that are really top of mind. And one of them is making sure that we're leveraging all of the access points that we have available to us to provide care, whether that's face-to-face care with a pediatrician, whether it's virtual care, or even telephonic care, including access to physician extenders, for example, like nurse practitioners. We talked earlier about the fact that the pipeline of physicians going into primary care is decreasing, and that's no different for pediatrics. So we need to make sure that we're leveraging all of our access points to the best of our ability. And then the other thing that's really critical and really important now is that pediatricians and those that take care of children are heavily involved in speaking with the child's parents
Yeah.
or caregivers about vaccinations. And when I say dialogue about vaccination, it's not just at the well care visit, but it should be at every opportunity. There are so many questions that parents have, concerns that they have, and every opportunity provides a chance for the parent or the caregiver to be properly educated and to make the right decisions about vaccination. And then the pediatrician should encourage taking advantage of each of those opportunities to vaccinate our children appropriately. I think those are two critical elements that we need to focus on going forward.
Thank you so much for that and elevating the importance of vaccines and pediatricians as trusted providers for families and educating and also importantly listening, right? Listening to those families and those parents.
We talked prior to the recording about our families and the fact that we have children that we've raised or are raising.
Mine too.
And, as a parent and a pediatrician, I want the best for my patients
That's right.
that I wanted for my own children. And it's important that we kind of carry that forward in all of our interactions with our patients and their families.
Absolutely. And that common ground, like every parent wants the best for their child. So it's just a matter of how can we help every parent achieve that. So thank you. Thank you for noting that. You spoke about your experience. I mean, you've worked in the payer space, provider space. You've been on boards, senior leadership teams. What strategic questions should senior healthcare leaders be asking now or thinking about when it comes to value-based care, population health? We've talked about folks losing their insurance. Where is the puck headed, right? Where should we be looking from a forward looking perspective over the next decade of change in healthcare? What should we be doing now?
In 2024, so just a couple of years ago, the Commonwealth Fund released their latest report on healthcare outcomes. And the Commonwealth Fund looks at 10 countries and looks at their healthcare performance based on outcomes. The most recent report showed that the United States, despite spending more on healthcare services to the tune of $5 trillion, roughly 18% of our gross domestic product, overall has worse health care outcomes than other countries. We know we have the ability here. We have the technology. We certainly don't have a problem spending. We're spending nearly 20% of our GDP.
Mm-hmm.
But we have to think about areas where we can do better to drive outcomes. The other thing that the report showed is that when you look at areas around care process, things like preventive services, we talked about mammography earlier.
Mm-hmm.
Think about flu vaccination, for example, or patient safety. The United States actually does fairly well compared to other countries. And in my mind, that raises the question whether or not we really need to think about the pathway toward better engagement around value-based care, because each of those elements that I mentioned are elements that are critical and critical measures in value-based care arrangements and value-based care contracts. So that report may indeed be giving us some directionality in terms of where we need to think about for the future. And thinking about how we want to show up as a society in terms of the health of our population. I think that we need to think more seriously about value-based care adoption and figure out ways to accelerate where we have strengths, and that will allow us to get lift in areas where we have weakness.
Absolutely. And again, that 20%, 18% of GDP is just ridiculous, quite frankly, given the outcomes that we see. And quite frankly, also the differences in outcomes across different populations, those disparities. So thank you for that. And as you talked about, what do we want to be? Value-based care, but it's also what are our values, right?
Mm-hmm.
What does that say about our values and the way that we see these disparate outcomes and people losing insurance and challenges with accessing care? What are our values that we really want to lean into as a country when it comes to valuing healthcare and good outcomes? So last question for you. For our listeners, Dr. McCauley, what is one actionable tip or resource or just piece of advice you'd recommend for colleagues who are really striving to advance broader population health outcomes?
I think that we should stop, to the extent that we can, working in silos.
Mm-hmm.
We talked earlier about health and data information exchange. And if you think about it, that's an exchange of information, but we also need to focus on exchange of ideas. And I think there are wonderful opportunities for private insurers to work with public insurers around techniques for engagement, interaction with populations to help drive better outcomes. We have a tendency to put our heads down, to work in the space that we're in, and not necessarily look up and see what's going on around us. And I think if we can get out of our silos, communicate with each other, and going back to one of the things that you said, think about and agree on what we want to deliver as far as healthcare and healthcare outcomes, I think that will present the opportunity for us to work closer across healthcare landscapes and drive better outcomes for all of us. And that's really what we want. We all want the same thing. We want a healthy family, a healthy community, and healthy societies. I think that we should, again, de-silo our work and move forward in a different manner.
So well said. Thank you, Dr. McCauley, so much for being on our podcast. It's been a pleasure speaking with you, and I know our listeners will enjoy your comments.
It was an absolute pleasure, and I'm so grateful for the opportunity to speak with you. Thank you.